Hello, my name is Madeline, and I'm going to be discussing the advanced physical assessment technique of Egophony. To begin, this skill is specific to the respiratory system. In its simplest description, this technique is performed through auscultation of the lungs. Egophony, coming from the Greek word ego, meaning goat, is a type of voice sound that presents as increased resonance when auscultating the lungs. Voice sounds are produced when air passes through the vocal cords, making them vibrate. In a healthy individual, these adventitious sounds are not as audible. However, when consolidation or fluid replaces the air in the lung tissue, these sounds are better transmitted. So, to perform egophony, during auscultation, the patient is asked to say E. The E will be transformed into an A, and the voice will take on a nasal or bleeding quality, like the bleating of a goat. This auscultatory finding is due to a change in the quality of the voice. A consolidated, fluid-filled, or compressed lung decreases the amplitude and only allows select frequencies to pass through. This changes the sound of the vowel E to an A, which is why this technique is also known as the E to A change. Assessing for egophony may be indicated with pneumonia or pleural effusion is suspected because it is typically present in these cases. So, now I'm going to demonstrate this skill with my patient Cody. Hi Cody, my name's Maddie. I'm going to be your nurse today.
Hi.
Okay, so I'm going to listen to your lungs with my stethoscope here. I'm going to be listening to you from the front, from each side, and from the back, okay?
Okay.
Now, I am going to ask you to say E for a brief period each time you feel my stethoscope hit your chest in each different location, okay? All right. So I'm going to have you just pull your shirt up a little bit and try to warm this up for you a little bit, okay? All right.
E. E.
All right. Hold it out a little bit longer for me each time, okay?
E. 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 E.
Okay. Now, if you could just kind of turn to the side for me, I'm going to listen to your lungs from the back, and it's going to be the same concept as before, okay?
Okay.
I'm going to start from the top up here.
E.
Okay.
E. 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 E.
Okay. Awesome. Thank you very much. Okay. As you can see, as with any typical respiratory assessment, it's common to auscultate the anterior, lateral, and posterior chest lung fields bilaterally using the technique that was just described previously. Other important considerations include auscultating the patient in a quiet room, ensuring that the chest piece of the stethoscope is in direct contact with the skin, not in between layers of clothing or blankets, which can negatively impact what you're hearing. And also just thoroughly explaining the technique to the patient prior to performance. It also may be important to give your patient time to rest during this assessment, considering he or she may be dealing with impaired oxygenation related to pneumonia or another infectious process, or even pleural effusion. As mentioned before, egophony will only be present in cases of consolidation or pleural effusion. In a healthy patient, such as my volunteer, this E to A change, or change in voice sounds, will not be present. So, as he was saying E each time, that's exactly what I was auscultating and hearing through my stethoscope. So, as I just mentioned, when the patient verbalizes that E sound, it's exactly what's resonated and auscultated through the stethoscope. versus the A sound that would be auscultated in a patient suspected to have pneumonia, pleural effusion, or another similar condition. To summarize, egophony is present if the sound you hear is an A instead of the spoken E, indicating evidence of lung congestion. In clear, healthy, air-filled lungs, the spoken E will also be auscultated as an E. The mechanism of egophony is as follows. The sound of the vowel E has a much higher frequency in comparison to the sound of the vowel A. Consolidation or fluid-filled lungs create a dense medium which facilitates the transmission of lower frequencies. Therefore, congested lungs cannot transmit the higher frequency of the E, but it can transmit the lower frequency of A very well. So that's why the voice sounds in patients with underlying consolidation or effusion transform the E to an A. So this assessment technique will rarely be used independently or as a standalone diagnostic. It should certainly supplement a more comprehensive respiratory assessment. It will be important to obtain a patient history, baseline, and current presentation of the patient you're assessing. This can include questions such as, are you having fatigue or activity intolerance? Do you have any current or recent respiratory issues? Do you have any chronic respiratory issues such as allergies or asthma, or do you require supplemental oxygen? Do you have a cough? How long have you had the cough? Do you have any difficulties with your breathing? What, if anything, causes you to be short of breath? Have you had any chest pain recently? Also, you could ask about smoking. It's also important to observe the patient's respiratory rate, respiratory rhythm, depth, effort, and also observe for symmetry of chest and respiratory movements. You should note the color and condition of the skin as well, making sure they're not cyanotic or anything of that nature. Then you also want to auscultate breath sounds for any abnormal or adventitious sounds. This all will typically be performed prior to doing something such as egophony. You may want to proceed with this advanced technique explained in the demonstration if evidence of lung congestion is present based off of your prior assessment. All right, so that concludes all of the information required for the advanced physical assessment technique demonstration of egophony. Hope you enjoyed.